Hello everyone, this is Dr. Sandeep Madan and I am anatomy faculty at DAMS, and we have observed recently that there has been a trend of asking questions in a clinical integrated manner, be it NEET or any central exams, right? So what do? They ask a clinically integrated question, and at the end of the question you will be asked about the basic anatomy or any basic subject for that matter, right? And DAMS has always been the fastest and earliest to adapt to any change in the question pattern. And you may see that we have already started the clinically integrated questions years back. And also we have a DQB, that is the DAMS question bank, where you can see the clinical vignette as a part of the question bank, right? And today I'm going to take a topic that is a clinically integrated approach of anatomy. Let's take the question. So we have this 65-year-old woman with a known history of lung cancer comes to hospital due to hoarseness and difficulty in swallowing. She has no disturbance in vision and hearing. On examination, there is loss of gag reflex on the left side. When the patient is prompted to say ah, the uvula deviates to the right side. Her left shoulder is drooped and strength is reduced during left shoulder shrug testing. Chest X-ray shows a right lower lobe lung mass and several osteolytic reblations. MRI of head also demonstrates multiple lesions consistent with the metastasis. A lesion involving which of the anatomical structure is most likely responsible for this patient's symptoms. And now we have been given these choices like CP angle, foramen magnum, ovale, rotundum, hypoglossal, or the jugular foramen, right? Now to come to the answer of this question, let us discuss the relevant anatomy. Yes. So we are going to take a topic that is a 10th and 11th nerve together, and just before that, let me write the two nuclei which are compound nuclei. One of the nucleus is nucleus of tractus solitarius, nucleus of tractus solitarius. And what is this nucleus? This nucleus in short it is called as NTS because it is a compound nucleus. Because it is a compound nucleus, it is having the components. What are the components in it? They are in the name itself: N for 9, T for 10, and S for 7. So NTS is a compound nucleus. 9, 10, and 7 are the components in it, right? Now we can look at the another nucleus, that is nucleus ambiguous. That is nucleus ambiguous, and this nucleus is again a compound nucleus, and the components are 9th, 10th, and 11th. So we have seen two nuclei. One of them is NTS having 9, 10, and 7. The other is nucleus ambiguous 9, 10, and 11. And now when we are looking at this nuclei, let us start the discussion of 10th nerve. And you see we have, this is our medulla, and the lower end of the medulla passes through the foramen magnum, this is medulla, and then it continues as spinal cord, right? Okay. And within the medulla we have this nucleus called as nucleus ambiguous. From this nucleus ambiguous, the 10th nerve comes out. This is 10th nerve. All right. Along with the 10th nerve, this nerve comes out, which is cranial root of accessory nerve. That is, you can write cranial root of 11th nerve. Okay. And from within the spinal cord, from C1 to C5 segments, this nerve first enters into the cranial cavity by passing through the foramen magnum, and then it is ready for the exit, right? What is this nerve? This is spinal accessory nerve. This is spinal accessory nerve. And everything, that means these three nerves, 10th nerve, cranial accessory, spinal accessory, along with the 9th nerve, they all will exit from this foramen called as jugular foramen. So they are all going to exit from jugular foramen. But the exit becomes quite interesting here. How? Let me explain. The spinal accessory will exit as spinal accessory nerve from here. Yes. The 10th nerve will exit as 10th nerve. Yes. But the cranial accessory, you see, it will ditch the original partner, will go to the new partner only for the exit. And once the exit is done, it will come back to the original partner. Yes. So now this is ditching someone, going to someone else, and then coming back. It might remind you of something or someone, but let me tell you guys, believe me, we are still talking about the nerves, right? And when the nerve has come back, now the 10th nerve and the cranial accessory, they are together again. What is the kahani of spinal accessory? Tanha the tanha hai, and it will go and supply one muscle, two muscles, that is a sternocleidomastoid muscle and the trapezius muscle. Fine. And when this cranial accessory left, 10th nerve was singing a song. Which song this was? Isme tera ghata, mera kuch nahi jata. Cranial accessory came back. When the cranial accessory came back, now the 10th nerve told, okay, you come back, you're welcome, but this time we will make a complex called as vago accessory complex. So this is a complex made by vagus nerve and the cranial accessory nerve, and name of the complex is vago accessory complex. Now what is the importance of this complex? The importance of this complex is this vago accessory complex will further make pharyngeal plexus, and via the pharyngeal plexus it is going to supply most of the muscles of palate and pharynx, with few exception. Okay, one exception each. Otherwise this pharyngeal plexus is going to supply the muscles of palate and the muscles of pharynx, muscles of palate and pharynx. So in the palate except tensor veli palatini, and in the pharynx except stylopharyngeus. All right. And after having understood the muscles nerve supply of the palate and the pharynx, motor nerve supply, and now we are going to talk about the laryngeal nerve supply. Here's the skeleton of the larynx. So we have hyoid bone, we have thyroid cartilage, and further below we have cricoid cartilage. So this is the skeleton of larynx. Between hyoid and thyroid, we have this membrane called as thyrohyoid membrane. What is this membrane? This is thyrohyoid membrane. Thyrohyoid membrane. Fine. And there is a muscle which lies between cricoid and thyroid. This muscle is cricothyroid. Cricothyroid. All right. And now we have the nerves coming from above. This nerve is 10th nerve, okay, which is also carrying the fibers from the cranial accessory, and this will give two branches here. One branch from above the larynx, so it should be called as superior laryngeal nerve, and one branch below the larynx, it should be called as inferior laryngeal nerve. Inferior laryngeal nerve is known by the name of more common name, that is recurrent laryngeal nerve. All right, so we have superior laryngeal nerve and the recurrent laryngeal nerve. Now superior laryngeal nerve will divide into two branches. One branch remains outside of the larynx, it doesn't enter into the cavity of the larynx, so it should be called as external laryngeal nerve. And the other nerve on the other branch, on the other hand, it goes and pierces the thyrohyoid membrane in order to reach the cavity of the larynx. Because it is going inside the larynx, it should be called as internal laryngeal nerve. It should be called as internal laryngeal nerve. So now if we look at the laryngeal cavity and we stand at the level of the vocal cords, we see one nerve is entering from above, which is going to supply the mucosa above the vocal cord. And what is that? Internal laryngeal nerve. And one nerve is coming from below. Which nerve is coming from below? Recurrent laryngeal nerve. So if you look at the sensory nerve supply of the larynx, above, the mucosa above the vocal cord, we have internal laryngeal nerve supplying, and mucosa below the vocal cord, we have the recurrent laryngeal nerve supplying it, right? And what about the motor nerve supply? All the muscles of the larynx are supplied by recurrent laryngeal nerve except cricothyroid, because it is supplied by the external laryngeal nerve, right? So let me have a quick review here. So what did we discuss? What did we discuss? We discussed that we have a nucleus ambiguous from where the 10th nerve and the cranial accessory nerve exit, and the spinal accessory nerve first enters into the cranial cavity by the foramen magnum, and Then at the level of jugular foramen, they all are, I mean, coming out from, and then the 11th nerve, that is again the spinal root and the cranial root, are separate. Spinal accessory nerve is going to supply sternocleidomastoid muscle and the trapezius muscle, whereas the other two nerves, the 10th nerve and the cranial accessory, they are going to make the vago accessory complex, which is further going to make this plexus called as pharyngeal plexus, which is going to supply the muscles of palate except tensor veli palatini, muscles of pharynx except stylopharyngeus. Then coming to the laryngeal part, we have the from the vagus superior laryngeal nerve and the inferior laryngeal nerve, which is commonly called as recurrent laryngeal nerve. Superior laryngeal nerve will give one branch which remains outside the larynx, so it should be called as external laryngeal nerve. One nerve enters into the larynx, it should be called as internal laryngeal nerve. Fine. And they are going to supply the internal and recurrent laryngeal nerve are going to supply the sensory mucosa of the larynx from above and below the vocal cord, right? And there is a mention of this reflex in the question, gag reflex. And please understand, for the gag reflex, we have afferent and efferent. Afferent is ninth nerve and efferent is is 10th nerve. It is actually vago accessory complex, or you can, for clinical purpose, we say 10th nerve, right? Now let us go back to the question and read it again, and now let us solve the question from like how you in a clinical setting will actually look at the patient, right? Now 65-year-old woman, that is a patient's age and known history of lung cancer, comes to the hospital due to hoarseness of. Hoarseness means it is the laryngeal involvement, difficulty in swallowing, okay, and so you can say pharyngeal involvement is there. She has no disturbance in vision and hearing. There is a loss of gag. Now when the gag is involved, you can say that basically this patient is having either the 9th nerve or 10th nerve or both involvement. When the patient is prompted to say the uvula deviates, that means palate is involved. Now larynx, pharynx and palate, if these are involved, we can say the patient is having involvement of 10th nerve and cranial accessory nerve, or you can say VAC, vagus accessory complex. Yes. Along with that, the patient had reduced strength on the left shoulder shrug testing. This is called as shrug, and the trapezius is used for the shrug. If there is a reduced strength, means trapezius is also affected. And who supplies the trapezius? Who supplies the trapezius? Trapezius is supplied by spinal accessory nerve. Spinal accessory nerve. So if you combine the information, you have 10th nerve, cranial accessory nerve, 9th nerve and spinal accessory nerve. Now we know all these nerves, if you combine the information, it becomes 9th nerve, 10th nerve and both the roots of 11, so you can write simply 11. Now which foramen justifies the common involvement of these three nerves? Yes, you are thinking it right. Answer to this question is jugular foramen. I hope you have understood the concept, because as I told, now the focus is more on the concepts and not the rote learning, not the factual learning. It is the conceptual understanding that you should have. Okay. And also one advice from my side, that anatomy, you should not always think that it is a subject only for the mugging up. No, first you should have the conceptual understanding, and once concept is clear, it becomes very easy for you to understand, and it becomes very easy for you to remember it for the longer duration, right? Thank you so much, and keep following us.